Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about depersonalization, derealization disorder. In this video, we'll first look at what depersonalization, derealization disorder is. We'll then look at the risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Depersonalization, derealization disorder is a type of dissociative disorder characterized by recurring feelings of being mentally or physically detached from oneself and or possessing a decreased sense of reality through the detachment from one's surroundings. Such feelings can last for a long period and affect daily activities. Approximately 50% of the general population will have at least one brief experience of depersonalization or derealization in their lives, although only 2% of the population are diagnosed with this disorder. The average age of onset is 16 years, and it is rare to develop this disorder after the age of 40. According to a study, around 72% of people diagnosed with this disorder have another mental health condition, anxiety and depression disorder being the most common. Risk factors and causes. It is believed that depersonalization, derealization disorder is linked to experiences of trauma at a young age, including emotional or physical abuse or neglect during childhood, witnessing domestic violence, and death of a loved one. Depersonalization, derealization disorder is also linked to stress, including financial, interpersonal, occupational, or educational stress, anxiety, depression, lack of sleep, and drug use. Symptoms. People with depersonalization, derealization disorder can experience symptoms for hours, days, weeks, months, or even years. The symptoms of depersonalization include feeling detached from one's mind, body, and feelings, experiencing physical or mental numbness, feeling robotic or having difficulty controlling speech or actions, and having difficulty attaching emotions to memories. The derealization symptoms can include feeling detached from one's environment, having difficulty recognizing one's surroundings, or feeling like one's surroundings are unreal or dreamlike, having a distorted view of the distance and size of objects, and having a distorted sense of time, in which recent events can feel like they occurred a long time ago, and vice versa. Effects. Depersonalization, derealization disorder can become chronic, with some patients becoming disabled by the chronic sense of detachment. Depersonalization can lead to anxiety, depression, or both. Depersonalization, derealization disorder can be signs of other mental health conditions, including brain disease, seizure disorders, and psychiatric disorders such as dementia and schizophrenia. Treatment. Common types of treatment for depersonalization, derealization disorder include therapy and/or medication. Psychotherapy can help people manage their past trauma and develop coping strategies. A type of psychotherapy is cognitive behavioral therapy, which can help people develop strategies to understand and change their thoughts, feelings, and behaviors. Through cognitive behavioral therapy, people can learn grounding techniques, which uses the 5 senses to feel more connected to themselves and their surroundings in the present moment. Psychodynamic therapy can help patients manage negative feelings and conflicts they detach from, as well as focusing on the present moment. Dialectic behavior therapy can help people with extreme personality disturbances who may have experienced trauma or abuse. This therapy can help people manage negative emotions and dissociative symptoms. Family therapy can provide psychoeducation to family members to help them understand the disorder and recognize its signs. A healthcare professional may also prescribe medication to relieve symptoms, such as anti-anxiety medication and antidepressant medication. Coping strategies. There are a few coping strategies to feel more connected to oneself and one's environment. A person with this disorder can gently pinch their skin to feel connected to their body. Breathe deeply and slowly while focusing on the chest moving. Counting or naming the items in one's surroundings. Keeping one's eye moving to prevent zoning out. Practicing mindfulness to be aware of the present moment, including one's thoughts, feelings, and experiences. Regularly communicating with family members or friends to be more connected to other people and to reality. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.